Welcome to this series of videos where we talk to Dr. Warren Corns, who's Research and Technical Support Manager at PS Analytical, about mercury and the various issues to do with mercury in the environment and analysis of mercury. So Warren, we know that mercury is actually quite poisonous, but how are people exposed to it?
Well, the majority of people are exposed to mercury through their diet, from the consumption of fish and seafood. The mercury in fish is predominantly methyl mercury, which is the most toxic form, and methyl mercury is formed by bacteria, essentially, in the aquatic environment. So the atmospheric mercury, normally in the elemental and ionic form, actually goes into the aquatic environment where the bacteria convert it to methyl mercury, and this gets then consumed by fish and moves through the food chain. So the larger predator fish, such as tuna for example, they have higher levels of methyl mercury than the smaller predator fish, and also the age and the dietary habits of those fish can influence the levels of mercury. And as most government guidelines actually suggest that your fish consumption is limited. This is particularly important for pregnant women because methyl mercury is known to affect the nervous system of young children and also for the fetus. So for that reason, pregnant women should limit their fish consumption.
So food is obviously a key element then here. What other areas do we get exposure?
Well, of course, anybody working in an environment that uses mercury has to be particularly careful. Inhalation of mercury vapour is the most common problem. And in fact, when you inhale mercury vapour, about 80% of that mercury is retained by your body. The other mercury is excreted. And so there's a gradual build-up of mercury in your body through life. It is excreted, but it typically takes several months to come out your system. And one particular problem is dental amalgams. The silver fillings that are often used for restorations, they contain 50% mercury by mass, 30% silver, and about 20% of other metals such as copper, tin and zinc. And small amounts of mercury have been continually released from your amalgams, and about 80% of this mercury is retained by the body. And brushing your teeth, having hot drinks, grinding your teeth during your sleep are all contributing factors to increase the levels of mercury in your body. Dentists are also at risk because they're handling and removing amalgams, so it's a particular concern for that industry. People that work in the chloralkali industry or involved in mining are also exposed to high levels of mercury vapour, so they have to be particularly careful.